The former Ocean View International Hotel, previously described by Minister of Health Dr. Frank Anthony as a shell, has undergone a series of renovations to serve as a COVID-19 care facility. The facility was initially identified as a COVID-19 hospital under the APNU AFC administration and underwent rehabilitation works in April to the tune of $1.6 billion. The facility was commissioned by former President David Granger on July 30. However, when the PPP government took over on August 2, it indicated several flaws with the facility, which also lacked adequate equipment to care for COVID-19 patients. Thus, the government, in its 2020 emergency budget, allocated $790 million to operationalize the Infectious Disease Hospital. While a section of the hospital was previously used to house maternity patients who tested positive for COVID-19, Minister Anthony recently disclosed that the requisite amenities were put in place during the last 2 weeks for the operation of a COVID-19 intensive care unit.
We had to put in the oxygen and these gas lines and suction and so forth. So for the last 2 weeks, they have been installing those things, putting in all the equipment and so forth.
The minister added that patients experiencing mild to critical symptoms of the virus will be relocated from the Georgetown Hospital to the Lillian Doll facility.
We have another area where we have operating theater and some other spaces for recovery and so forth. We will be able to house a number of other patients in those areas as well. The intake area where people would have to come in when they're sick, we're still working on that section.
The Infectious Disease Hospital falls under the purview of the Georgetown Public Hospital. As such, frontline workers will be transitioned to the new facility from the Georgetown Public Hospital.
And as we transfer the responsibility over to Ocean View, then those doctors who have been operating at Georgetown Hospital and the nurses would be transferred over to that facility.
Overall, the facility can accommodate up to 102 beds. The decision to establish a COVID-19 hospital stemmed from a recommendation by the Pan American Health Organization, World Health Organization. Former PAHO WHO country representative Dr. William Adukro in April had highlighted the need for a specialized COVID-19 hospital by making recommendations to former Minister of Health Walter Lawrence. At the time, the International Health Agency had projected that Guyana's COVID-19 case count would hit 20,000. Guyana has recorded just over 4,500 cases to date. Temika Rodney reporting for the HGB Nightly News.